I want to talk about food intolerance testing and maybe what are some symptoms of food intolerances and what's the difference between a food allergy and a food intolerance. Because if you're coming to see a naturopathic doctor or functional doctor, it's very likely you're going to talk about diet, foods you need to remove from your diet, and maybe what food you're reacting to. So some side effects of a food, so a food allergy is like peanuts, your mouth is going to swell up, you're going to go in anaphylactic, you cough every time you eat, you get a rash. That's an actual allergy because what you're making in the you have so many soldiers that your body can make in the immune system, and that's called an IgE reaction. And what an IgE reaction is you're actually reacting with like a histamine reaction. So mast cells come in, histamines come in, that's why your nose gets runny, and it creates this huge flood of allergic reaction. That's why people take an antihistamine. It's more likely that people are reacting to something outside. That's typically seasonal allergies is what you see. Now, in functional medicine, lots of people are talking about food intolerances. So when I talked about the immune system making certain soldiers, this is more of an IgG response, and an IgG response in the immune system is usually going to be attacking a virus or a bacteria in the body, where IgE is going to be attacking an allergy or maybe a parasite. So it's important to know the difference because an IgE reaction doesn't last as long as an IgG reaction. So basically that's the difference, is an allergy is an IgE, it's totally different reaction in the body, it's histamine. IgG is going to be more of a long-term achy, not feeling very well, flu-like symptoms with what you're eating. So if you get an allergy, runny nose, skin rash, hard time breathing, coughing, that's an allergy. When you get sick, that's more of what you're going to feel like with an IgG reaction. So if you're eating something that now is being reacted with IgG, you're going to feel more achy, tired, stuff like that. So it's important to identify the things that you're reacting to because it's really putting a lot of burden on your immune system and your body. So again, that's why it's important to know when you go to ask your doctor, I want a blood test for foods, you need to know what you're asking for. Because if you go to a Western doctor and you say, hey, I want food intolerance testing, they're gonna most likely run an IgE panel, and it might be an environmental panel, and they might do a food panel for you too. But usually when you're looking for things that are more chronic, you're wanting an IgG test, and usually you have to see a functional doctor for that. It's a specific test we have to order in. A typical lab like Quest or LabCorp isn't going to run this test. It's going to be way more expensive doing it that way. So that's if you're curious, what am I reacting to, and you went to a regular doctor and they've run an IgE and they tell you you're not allergic to anything, you're not getting the food intolerance versus the food allergy. So it's important to know that. So symptoms of having food intolerances, there's a multitude. So let's say you eat and you're having a food intolerance to dairy. And every time you eat dairy, your heart starts racing. So one symptom with my patients that come in with heart palpitations is, let's figure out if you're eating something. Well, first off, let's rule out all the heart stuff, and now let's figure out if you're eating something. So heart rate variability will increase when you eat something. So there's some anecdotal research, there's not a lot of double-blind studies in this, that if you take your blood pulse or your how many beats per minute your heart is doing, and then you eat something and you wait a couple minutes, you take it again and it goes up, that maybe you're allergic to that food. So that's where that heart palpitation or heart racing comes in. Another huge symptom, obviously, is you eat something and your stomach hurts, or you're really bloated during the day. That's another thing. Another symptom of food intolerances is acne. Anything going on with your skin that's chronic is another big one. The other thing is when you're eating something you're allergic to and you create an immune response, that has to be deposited somewhere in the body, and so lots of times people will get a lot of joint aching. I take almost all of my patients off of gluten who have any kind of form of arthritis, and personally when I eat gluten, my feet always ache. I'll be laying in bed, I'm like, what's going on? I'm like, ugh, there must have been gluten in that. And so really being able to observe that for your body. I had another patient, her fingers were peeling really bad for years and years and years. She had done IgE with her doctor and nothing came back. We did an IgG and she came back really allergic to tomatoes. And even now, 4 years later, every time she gets tomato in her diet, her fingers start to peel and crack. Another huge one is that your food intolerances can make you feel really anxious, they can make you feel depressed. I know particularly with the gluten and dairy, it can make you really short of breath, so it makes it so you can't breathe very well. It will exacerbate your asthma as well. Other symptoms of food intolerances is constipation. And hypothyroid can also very much be linked to problems with food intolerances because the immune system has been worn out. You're reabsorbing toxins into the system, and eventually it just starts to deposit in the thyroid and it'll cause problems with that as well. So a really great place to start with any functional doctor, with a naturopathic doctor, is to figure out what foods you're eating and eliminate all of those before, you can do hundreds of supplements for heart palpitation and drugs and all kinds of stuff. And so often with my patients, we've been working together for 6 months. I can't get them where they need to be with their migraines, maybe particularly, and then we do a food panel and they're allergic to flax seeds, and they've been putting flax seeds in their smoothie every morning thinking they're doing something healthy, and then come to find out it was bad. They take it out and their migraines go away. It's not always that simple, but it's a really simple way to start. So that's the difference between food allergies, food intolerances, and the testing to maybe ask for your doctor as well. Thank you so much for watching our video. Please subscribe below so YouTube knows that you like this content. Ring the bell. Much more to come, and please leave a comment if you have any additional questions or comments. Thanks a lot.